A lot about the skyrocketing price of prescription drugs.
And now there's a push in Annapolis to force drug makers to justify some of those increases. ABC 2 News' Jeff Hager has more on some of those proposals tonight. Jeff?
Kelly, with no sign that the federal government will rein in the drug companies, Maryland may take its own steps to stop the price gouging. There is no cure for early onset Alzheimer's disease, but some drugs can treat the symptoms. If only Bonita Spikes could afford them.
When I first got diagnosed, I was covered by good insurance. When I couldn't work anymore, I didn't have insurance. And short story is I couldn't afford my medication.
In recent years, critics say many companies have driven up prices on generic drugs, which had remained affordable for decades.
In one case, a 64-year-old drug had the price rise from $13.50 a pill to $750 a pill. 5,000% increase.
The price of the generic drug used to reverse heroin overdoses, naloxone, has doubled as the demand for it has reached epidemic proportions.
Why is it that at a time of a public health emergency, we are priced out of our ability to save lives? In Baltimore City, we have had to make the difficult choice of deciding which patients we should be giving this life-saving medication to. That should not have to happen.
The president of the Maryland Citizens Health Initiative, Vincent DeMarco, says proposed legislation in Annapolis would address the gouging.
Right now, we don't know if there's going to be a big jack in the price. Under this bill, we'll get 60 days to know, and with alternatives provided of what we can do if there's going to be a big increase in the price. We need that. We need the disclosure. We need to give the Attorney General's prices this authority.
The authority to freeze prices and to impose hefty fines if the companies can't justify their increases. It's a bid to keep consumers like Bonita Spikes from being priced out of the medications they so desperately need.
One was over $500, and I think the other one was actually higher than that, but I don't remember exactly.
These tough new measures would target companies that have little or no competition and would force them to be more transparent in the costs of producing their drugs.